Last fall, we told you about a simple blood test to diagnose concussions. Now, a new study shows the test can detect concussions up to a week after a head injury.
CBS 2's Dr. Max Gomez reports that's important because symptoms can be subtle and undiagnosed, especially in kids.
It's estimated 250,000 kids a year end up in the hospital with concussions from playing sports, and Kate Ratliff was one of them. Last fall, we told you that Kate was diving for a ball when she collided with another player, and at first didn't seem to be seriously hurt.
We actually didn't get her checked out right away because she didn't have the symptoms right at the beginning, but a couple hours later she started vomiting and had a headache.
That's not uncommon. Signs of a concussion are often delayed, and if it takes a few days for symptoms to settle in, the only reliable way to diagnose a patient is with a CT scan.
You really want to minimize the amount of CTs that you do on your patients, particularly children, because they are a lot more sensitive to radiation and the bad side effects.
So researchers at Orlando Health developed a simple blood test that can not only detect a concussion, but a new study shows the results are reliable up to a week after the injury. Scientists studied nearly 600 patients over 3 years, focusing on biomarkers in the blood known as GFAP.
The markers that we are looking at are really specific to the brain and are not released from any other parts of the body, which is what makes them so unique.
The problem is many patients, especially children, don't always articulate symptoms at the time of injury. Since GFAP stays in the blood so long, it could extend the window for diagnosis, so doctors may be able to detect even subtle concussions days later. Right now, doctors often rely on patients to report their symptoms in order to make a concussion diagnosis. But sometimes players don't want to reveal their symptoms because they want to get back in the game. This blood test could take the guesswork out of making the diagnosis. Dr. Max Gomez, CBS 2 News.